All right, welcome, Saray, to the Dental Hygiene Basics podcast. Today is a super exciting day because we're actually on the floor, the exhibition floor at RDH Under One Roof, which is a huge dental hygiene conference. If you're a future dental hygiene student or a current dental hygiene student, you definitely want to attend this conference when you get the opportunity because it's just buzzing with an insane atmosphere, right? Everything's crazy. And so on the podcast this morning, I'm live here from the RDH Under One Roof show. I have Saray with me. Saray and I, we met earlier this week at an amazing, what would you call it? A leadership conference?
Yeah, I mean, it was like a smaller group of like-minded people. It was just sort of like a mastermind.
Yes,
Yeah.
I think that's the best way to put it, a mastermind. And so we both went to this mastermind to basically explore life outside of the op, thinking about different opportunities, thinking about expanding our careers. And that's where you and I met. And so I was like, who wants to be on the podcast? And Saray stepped up and said, yes, I would love to be on the show. So I'm super excited to have met you and to have you here and just your willingness to put yourself, in the hot seat so that I can interview you this morning. So I just want to know, tell me a little bit about your RDH origin story. How did you get into dental hygiene and what got you to this point?
Well, thank you for having me on the podcast. I for sure volunteered because I was like, you know what? Something's been holding me back. And, this conference was all about empowerment and, just getting out of your comfort zone. And I said, you know what? I'm going to do it. I'm going to do it. I have some time. Let's do it. But my origin story begins very early because my cousin, who was like my big sister growing up, she's a dentist. And so her going through dental school, she would bring me in as her patient dummy. Yeah. So it was kind of like, if you can't fight them, join them kind of thing. So, that's back when, not to age myself, but that's when the curing lights looked like huge guns that would blast you out of space. So her first job as a dentist, she would bring me with her. And I would be the assistant's assistant. So I would pass them cotton rolls and they would pass them to her.
Love that. Yeah, that's awesome. Okay, so you decide you have this vision of life to become a dental hygienist.
And originally it was dentist.
Oh,
and
okay.
It wasn't until I was doing my undergrad that I was like, well, there's such a disparity and there's such need for prevention. And I was like, I love talking to people. I also wasn't sure if becoming a dentist would give me the same freedom that being a hygienist would allow me to do, where we can do literally so many other things other than clinical. And I feel like a lot of dentists end up joining just to be practicing nurse, and, that's great. I just didn't see myself as that. And so, yeah, so now, evolution is exploring that other side of non-clinical.
Yes, I love that. And I like what you said, there is a difference between a dentist and a dental hygienist. The dental hygienist is rooted in prevention. We're trying to prevent disease, right? The dentist is also trying to prevent disease too, but also restoring and fixing things. But I like what you mentioned that you thought you would have more freedom as a hygienist, which I think a lot of hygienists who are currently hygienists maybe don't feel that way. They feel kind of tethered or something. But when we really think about the career of a dental hygienist, if you're working clinically, one of the best things, and if you're a parent or if you are one of those people, it's like, I need to work and then go home and focus on other things. The beauty of working clinical dental hygiene is you go to work, you do the job stays at the job for the most part, right? Like your job in that day is to care for the patients. And at the end of the day, the patient care is done. So your job is done. So you really can go home and just turn it off, which is something I miss because now that I'm exploring outside of the op, and I've talked about this with a few other people that I've met on the podcast, it's not always what you think on the outside, right?
Right.
Especially if you're moving into entrepreneurship or speaking, you're looking at nights, weekends, you're looking at a lot of work that doesn't always just end and shut off. It doesn't. It's like your brain is always going. And so I think that that's a fun kind of topic to hit on. I don't think I've talked about it that much. So I really like your comment about that. There is a lot of freedom, not only within being a dental hygienist in the op, but also expanding outside the op in our potential career roles. Right now, you're a practicing hygienist, right?
I am.
Yes. And then what are you thinking for the future?
Well, right now I'm actually enrolled in a myofunctional therapy course. So that is next for me. So the next 3 months, I'm going to be back in school to become a myofunctional therapist. I learned about that option last year at Under One Roof. It was my first Under One Roof. And I was like, I'm sorry, we could do what? And I looked more into it, and what really sat with me about that trajectory was I had been suffering from TMJ pain from clenching. I'm a migraine sufferer. And I said, how amazing would it be if I can actually help my patients? Because, how many times do you have a patient come into the operatory and say, I have such bad TMJ pain? But until you really experience that, you really don't know and how much pain or how much it affects them in their lives. And I was like, what if I could be that additional person that can be like, oh, well, not only can I treat your oral health, but I can also treat your oral health and overall health by helping you with your function. So that really struck a chord with me. And I was like, well, that's what's next.
Yeah, that's exciting. I love myofunctional therapy. Actually, one of my first guests on the podcast was a myofunctional therapist.
Love it.
I think it's such an interesting career field and such a great intersection between what we do as dental hygienists, but also what we're capable of doing beyond the traditional, what most people think a dental hygienist does. And this is totally random off the cuff, but something I was actually just scrolling through Instagram earlier and I saw this post that was talking about how the jaw is actually related also to like the pelvis. And so when we get really stressed out, our jaw clenches, but we also naturally clench like our pelvic area as well.
Wow, that's so interesting.
Yeah. And they say that we store a lot of emotions in our jaw and in our pelvis area. And there's this fascia that connects them both together. If you ever see like a picture of fascia, it's totally wild.
Yeah.
So even beyond that, it's like you're going to continue learning things that you probably couldn't even imagine, and you start to see things in a different light. And I think that's so amazing. So I want to know, where did you go to dental hygiene school?
So I went to NYU, College of Dentistry. I'm
Yeah.
originally from New Jersey. It was really funny because I actually did the fast track.
Okay.
So it was a 17-month program.
Wow.
It was a full-time commitment. So it was 17 months straight. We had 3-week break the whole 17 months.
Oh my gosh.
That was it.
Yeah.
But it was a small chance, 20 seats available. And I was like, I'm committed. Like, this is what I want. Yeah.
That's awesome. It's really funny. This is not by design. It just has happened to happen this way. I think I've had 4 other students from NYU on the show. Yeah. So the first was Jose, and he actually is going to be doing some other stuff for me on the podcast. And I think this episode will come out after those other NYU ones have come out. So I'm like, I need to market heavily to the NYU crowd. But
absolutely.
Something that you told me, there's a fast track program. I didn't learn that when I spoke with them because I think Jose did the bachelor's, like he was taking an extra year. It's like you could do the associate, the bachelor's, and then, yeah. So I think that's so interesting that even within one program, there's so much variation in things that you can do, which is amazing. So, okay, you went to NYU. What was your experience like? What was the most difficult aspect of dental hygiene school?
This is actually a great segue to like my next thing of like what I'm planning on working on. One of the things that I found was challenging. I'm a very people's person, but what I wasn't expecting was when I entered the clinic floor, I was overcome with a lot of anxiety.
Yes.
Because it was overstimulating. It was very overwhelming. I had also practiced as a dental assistant before going to hygiene school. And I remember having that feeling of like, when the instructor left my bay, it was like, oh my gosh, there's a whole human that I'm responsible for. I'm sure parents out there can relate. I'm not a parent, but it was sort of like that. It was like, oh my gosh, what if like my instrument flips and I gouge their gum? I don't know. It was just so intense of a feeling. And I remember just having so much anxiety that I did end up seeking therapy, which, that's another topic that's near and dear to my heart. And I'll be coming up with more resources for us dental professionals because I think it's a topic that not a lot of people are willing to take on, but it's a lot of things that we struggle on.
Yeah.
For sure.
Absolutely. No, and I couldn't agree more. I did talk therapy through dental hygiene school. I'm a huge advocate for listening, the awareness, checking in with yourself. I think a lot of people, they're like, this stress is normal. I'm scared or this or that. But realistically, it comes to a point where it does start to impact your ability to perform, right? Whether
Absolutely.
you realize it or not, because a lot of people, especially if you're a type A human, you may be used to anxiety and pushing through it. But when you're going through a program like that, you really need to be on you need your mental status to be on like full capacity because when we start
even
to get
more
anxious,
than full capacity.
Yeah.
Yes. It's like 150%.
Yes.
Yeah.
And when we start to get so anxious like that, it does actually reduce the ability to learn memory, like to actually retain information and to, just perform at your highest level. And having someone, a third party who is unbiased, who's not going through it with you to just kind of release all of that emotion is so important. And a lot of schools that you can tell me, I don't know about NYU, but did they have free therapy for students?
They did. They did. So I was lucky enough that the therapist that I was linked with at NYU recognized early on that, what I needed was more than just talk therapy, that I also needed probably medication management, just because my anxiety was just so taxing, that she did refer me out to a psychiatrist. And I did get the help that I needed at the time. And I will forever be thankful to her. She actually has focused her career to treat students. So most of her students were NYU dentistry students, whether it was, hygiene or from the dental program. But yeah, that was her thing. And I mean, I will forever be grateful to.
I love that. I heard on a podcast the other day, it was like the more specific, the more terrific. When you're going into like entrepreneurship or into a specific field, it's like, yes, if you can niche down and find that one person that you love to help. And for her, it was dental students. And
yes,
we all know that dental and dental hygiene students are going through immense amounts of stress. So I love that she specifically works with them. That's amazing. Yeah. And I was the same. I took medication while I was in dental hygiene school, and it saved me because I was just a mess, so anxious. And I'm a high performing anxious person. So
same.
yeah, it's like I can get a lot done, but if you can't fall asleep at night because you're thinking or you're not sleeping well, it's like, it's just one domino that lays down after another.
Absolutely.
Yeah.
I agree. But yeah, so, I mean, if you're in the New York City area, this is, this is not sponsored by anybody, but, obviously, NYU has resources, and Dr. Bradshaw is her name. And, I mean, working with her was very good for me and for what I ended up becoming, like she literally carried me through graduation.
Well, and the good thing that I hear too, and the thing that I love to share, I know you're an open soul, you love to connect. And so I'm thinking students who are in the area, or just students in general, if you're struggling with mental health, you're an amazing resource for that,
Thank
a
you.
soundboard, which is great. And I'm so excited to see what you end up doing, with your career beyond the op. I know whatever it is, it's going to be amazing. So what final advice would you have for someone maybe going into this journey, maybe a former version of yourself? What would you say to that person?
This is like keeps coming up, the former version of myself. Like, what would you tell that little girl or whatever? But what I would say is, if you fall down, like, it's okay. It's okay. Like, we feel like the world is watching when we fail. I think that we're the ones that are paying the most attention. And so we feel like the whole world is watching. I just came from a keynote speaker that was talking about resilience and how we're put in these situations. And, a bad day could be just from one bad thing that happened. And we don't have to let it. In hygiene school, you're going to encounter a lot of, those hurdles and obstacles that, I remember the first time picking up an instrument, I was like, I can't do this. It was an 11-12 Explorer. And I was like, I don't feel anything. But yeah, just those little things. And when you look back at it, you're like, it was a little silly, like, look how far I've come. So I would say, look back, just so you can see how far you've come along, because we don't do that enough. We're so hard on ourselves on a day-to-day that we're like, oh my gosh, where am I going? What do I need to do next? But then we fail to look back, and it's like, wow, look at all of the things that I have accomplished. Whatever it is that is like holding you back, just look at it. Once it's done, and you're like, wow, I did that. I did that.
I know. And I think that that's something that I learned this week at Evolution, meeting all of these incredible hygienists who are like movers, shakers, looking to shake things up, try new things. But one thing that I think we all had in common was we felt those feelings of fear, failure, imposter syndrome. And one thing that I was reflecting on is, I'm recording this podcast with hygienists. You're in a position that these students want to be in. Remember, there was a time that all we wanted was to get into dental hygiene school and become a dental hygienist, and we did it. And I think that one, that's so motivating, but it's also, like you said, taking that moment to take a look back at how far you've come, because there was a time when you did not know what you were doing with an 11-12 Explorer. You were like, I don't feel anything. Now you don't feel anything because there's nothing left behind it.
Yeah.
Yeah. And what you mentioned about, when you fail, you think the whole world is watching when really you're the one that's watching it the most. And you're the one that's sitting in those quiet moments, like beating yourself up, all of that, right? No one else would be in that room with you, like treating you like that. I mean, for the most part, I know there's some bullies out there,
Right.
but what are the things you're saying to yourself? And yeah, I just think that that's a wonderful pearl of wisdom to really think on. And I know for me that the reason why I say it is the moment I'm alone, right? The voice in my head is like, you shouldn't have done that, or you failed at this, or you did that, and you have to be aware of it. You can't just let that voice just talk
Right.
and not be aware of what it's saying, right? And if you start to check in and listen to your thoughts, you'll realize maybe I'm talking to myself in a way that's not actually serving me in the long term, right? Yeah. And the more you do it, the better it gets, or the easier it gets.
Yeah.
Yeah. Well, I love that advice so much. And I've loved meeting you and getting to know you. And I just want to say thank you for being here. Just take a minute, if you would, to share where students can find you, and we'll wrap up for the day.
Yes. So currently we are actually, this evolution thing is about evolving. So for the time being, you can find me at the Flossy Lady, the _Flossy _lady.
I love it.
But as I'm pivoting to bring more awareness to my functional issues, to mental health, I might be switching up a little bit, but for the time being, that's where you can find.
Yes, awesome. Man, if you hear this years from now and you can't find her, just get with me and I'll get her.
Absolutely. Yes,
fantastic.
yeah. Because
Yeah.
this connection will be for a lifetime for sure.
Yes,
I mean, you're
absolutely.
thank you so much for even giving me the opportunity to have a voice, right? Like, I think that that's what I was waiting for somebody to say, like, hey, do you want to share?
Yeah.
And being, as I learned this week, a high I personality and the DISC model, I'm like, yeah, I'd love to do it.
Yes. No, it was a huge blessing for me because, I was like, I got to find someone to come do the podcast. So I really appreciate it. It's just been a pleasure getting to know you, and thank you for being on the show.
Thank you.